When you talk about creating a culture of quality, primarily means is that quality is everybody's responsibility. 2005 approximately, so there was no quality standard, something like that quality standard specific for healthcare was not available. So we came up with a concept called one NH, one process. We follow every day and night the similar standard. When we come to India or we come to nationally here, we have some framework, but it is not very stringent. So the customers are more aware. They want to understand everything what's going to happen during a procedure or when they are in the hospital. So quality was considered as a paper department. Now we'll move to another level of thing which is called artificial intelligence.
Have you ever heard about a Michelin-starred restaurant? You definitely know about a 5-star hotel or ANCAP ratings when you recently went to buy a new car. What are these and why they are called for what they are called? These are the standards for the quality and safety. But have you heard the same about any hospitals in India? Probably you haven't. But today we have someone who looks after one of the leading healthcare chains in India and ensures your safety, your healthcare meets the international standards. We welcome today the Group Head of Quality at NH, Ms. Rashmi Srivastava. Welcome, ma'am, to Healthcare Off the Clock.
Thank you, Mukul.
Ma'am, your designation suggests us a lot, but still a big audience won't understand what exactly it is. So tell us about your role at NH and also just let us know how do you transcend to this role from where you started?
Okay. Thanks, Mukul, for asking this. I think first time I'm telling about this journey, how I moved to quality or how I choose quality as my career path. So I joined Narayana as a management trainee. Okay. And then I was working continuously with operations, starting my, working in the various departments across NH. And till 2005 approximately, so there was no quality standard, something like that quality standard specific for healthcare was not available. What everybody was trying to follow is the ISO standard, which is very, very generic in nature and that can be applicable to any industry, be it manufacturing, be it automobile or anywhere. So then in 2000 approximately 6, the new standard launched by Quality Council of India, which was exclusively made for hospitals. So which we call it now is NABH. NABH is a buzzword now, everybody knows about it. But that time we were the first few hospitals who really wanted to implement that standard in Narayana. And from operations, Dr. Shetty asked me to do it, go ahead and implement that standard. And I was also clueless, frankly, I didn't know what is written in the standard. Then after going through the standard, then we realized that it is something which is very important and very meaningful for the healthcare industry. So then I thought, okay, let me try that and implementing that since already I had my operations background. So that, excited me a little bit more because now I know that I can put those processes in a very systematic way in Narayana and then we will have something to measure how are we performing on those, those processes. So that's the journey where I started transcending into the quality systems. So now coming to your second part, what quality in healthcare and what do you mean by quality when we say in healthcare? So quality is like I relate with 3 words, which is called consistency, reliability, and which is meeting the standard of what your customer expectation is or what your stakeholders expectation is. So I think when we talk about consistency, reliability and meeting the standard, so how do we do it? So primarily we do it by, making sure that we have a set policy procedures in place, okay? And how do we measure it and what do we do after this, after measurement? So we continuously improve, right? Because quality is not something where you are just at one place and not moving, right? So that is possible only when you create a culture of quality or a safety within the organization. And that is the most difficult job, what you can do it. So I think primarily where my focus is as a quality head is to create that culture in the organization. When you talk about creating a culture of quality, so I think that primarily means is that quality is everybody's responsibility. It's not just a tick box exercise, okay? When everybody comes in line and they understand what do we mean by quality, and that's how we start creating a culture of quality in the organization.
Yeah, I think this is the first time that I've known about how do we create quality standards or when exactly it was started for the hospitals in India. Now, moving on from there, so people can still imagine what would be the challenges of a doctor, for a nurses, for even the admin staff. I mean, those are the people that we experience things firsthand. Yeah. And what are the kind of challenges that you face, as a quality head, because that goes long into the system.
So I think I'll try to summarize the entire challenges. We face day in and out a lot of challenges while implementation, but I wanted to summarize into 2-3 very specific points. What we face on our day-to-day is, Narayana has more than 19-20 hospitals, right? And every organization has a different maturity level, right? So, and some of them are, more than 20 years, and they have a lot of legacy system in that. So, I think if I try to summarize everything into one, is how do you make changes? Change management is something which is a major challenge, which we are trying to overcome with with a lot of support from the leadership. And second one is, how do you align everybody when they come on board or when they are working here with the quality standard, right? And third one is, how do you engage clinician and how do you change their behavior? Because for clinicians, I think all of us knows that whatever they do, they think that's the best thing they do and they don't need any changes, right? So as you mentioned in the beginning about the Michelin star, so it's like, you're asking a Michelin star hotel chef to change their recipe, which is very hard to do it, right? But I think it's possible only when you, start aligning everybody right from your front line to clinicians, to doctors, to nurses, everybody along with the system. And they start believing that the system is for improving the quality and patient safety for our patients. So once they have that buy-in with us, then I think that's the point where you actually start, building your culture of quality and safety. So, yeah.
So I'll go a little deep because you've just touched upon the surface regarding the quality. So we know that we have more than 30 plus healthcare facilities across India, including clinics and hospitals. It's a vast chain of network, if I have to say. And it's no small feat to have that standardization across these healthcare facilities. How do you keep a check on all of these things?
Okay. So I said first, once you have a buy-in from everybody, then it's easy for you to put any systems in place, right? So in quality, what we do is we have a very well-built framework within the NH, which we have done along with our medical directors and a lot of other stakeholders and the leadership. So something called as governance framework, right? Which includes the clinical, diagnostics, support services, facility, everything together, right? So that's a model which engages everybody in that, and then you put all your relevant parameter to monitor it, right? So that is something which always gives us a very defined and a structured way of measuring and monitoring across the group. Otherwise, it's very hard to monitor, so many hospitals on the similar parameter. Then how do you compare these hospitals, right? So for comparing also, you need to have a similar kind of measurement and the benchmarking. So which this framework gives us, right? Second one is we have a very robust internal audit program, okay? So when we set up policies and procedures and manuals across NH, right? So now the next thing is, how do you ensure compliances with that, right? So we have a robust internal audit system, okay, which monitors and gives us end of the month, how the hospital is performing. If they are not performing, then where they are lacking and what kind of improvement opportunities we get from those audits. So this is something, which this entire framework of monitoring, measuring, audit, compliances audit, okay, and putting standards in place, which gives us, a very reliable and comprehensive framework for monitoring across NH.
Yeah. I think it's very efficiently handled by you, and I'll tell you why. So through my research, I got to know that you have led Narayana Health to accreditations like JCI, NABH, NABL, and even nursing excellence. So I don't know about all of that. So can you briefly tell what exactly are they, and why these certifications or standard acquisitions are crucial and in turn impact the patient care.
Okay. So, the entire hospital accreditations are usually, some are coming from your national accreditation, which is from India, from Quality Council of India, whatever you said, NABL, or which is for the lab, or NABH for the hospital, or nursing excellence for the, for the nursing services, or we have standard for ER, or some standards are based on the, diagnostic procedures like stroke, and so there are a lot of standards available from Quality Council of India. So we usually, comply with all these standard in Narayana, try to implement, so it gives us the benefit and the consistency. And second one is what we have is international standard, which is most of the hospitals in India and abroad, they follow is a Joint Commission International Standard. Of course, it's available from the Canada or Australian. They also have the standard, but I think widely everybody follows is a JCI standard, which is supposed to be a gold standard for the healthcare. So I'll tell you, that last year we got it JCI Enterprise. So we are the only one in India who have got JCI Enterprise thing. So when I say enterprise, what does it mean? So Joint Commission is already a gold standard, right? And when we say enterprise edition, means that entire Narayana group is accredited by that gold standard. So all our hospitals which are part of JCI Enterprise are accredited, and it gives us the guarantee that all the hospitals are following the standard processes. They are measured on the equal parameter. Okay, we benchmark their performance, and then when any of these hospitals, when we talk, we always find the similar kind of processes and the policies in place. So this is something which is our greatest achievement for the last year, and now we are coming up with the renewal this year, and I'm sure we are going to do it very well in that.
So they say that it's rather easy to achieve a position,
Right.
but it's very difficult to live up to that throughout. And by no means, I think a lot of these accreditations are periodic in nature, right? And then you have to keep maintaining those standards. So you have attained that, but it is very difficult to maintain all of these standards.
Yeah.
How do you maintain these standards? Are there any protocols followed? You spoke about internal audits. So what are these checks, and what's the whole procedure is like? I'm sure like they change the standards to obviously upgrade it each year or once. I don't know exactly, but if you can enlighten our audience with that.
Okay. So what you said is right, that we always say also in accreditation or amongst the quality colleague is that when your accreditation is happening, you are almost like 100% compliance, you are at the peak of compliances. And I think after 4-5 days or maybe a week or a month, you come down at least by 40%. I mean, you can't maintain that 100% throughout. And as you said, periodicity is that we have a surveillance audit in between, and then we have a renewal. So renewal comes depends on the cycle. For national it is 4 years, and for international it is 3 years renewal cycle, right? So I think the maintenance of that, what we do is we have put in an entire framework around it, right? And which is called is this framework, what is it ensures? This framework ensures that we are always in the continuous readiness state, right? So whatever is the requirement of any standard, right? Be it's JCI or an NABH or any other accreditation standard or something which we want to follow as an internal quality standard, right? Everything has been put in a proper framework, okay? So if I talk just about my audit, right? So audit checklist almost comprises all these compliances point, right? So even if you are going and doing an audit in any of the hospitals, right? So checklists are so standardized, and it is done in such a simple way that even if you go and scan those or you get those checklists, you will be able to see whether are we meeting those standards or not, right? So this is something which we have evolved over a period of time to ensure that everything is embedded in the system, right? And we really don't have to worry about anything coming up today or tomorrow or maybe after 3 years or after 4 years. And we follow every day and night the similar standard what any accreditation body or our internal quality standard asks us to implement. So this is how something, which we evolve over a period of time of, maybe another last 5 years or 6 years. And that's how we have reached to a stage which is called a continuous readiness stage for any accreditation or any quality standard.
It's definitely a lot of hard work that has gone into it. So, ma'am, Narayana Health has received JCI Enterprise accreditation almost 1.5 years back, right? And I understand a lot of hard work must have gone into getting this, right? So, what are the 3 top initiatives that you had done or you would recommend any hospital to achieve this JCI Enterprise accreditation?
So, GCI Enterprise accreditation, as I said earlier, it's like we are the only hospital in India who has gone, and maybe globally also we are the 6th who have gone it at that time. Maybe not, a lot more hospitals would have been added right now. So I think this was a very massive exercise, right? Going for enterprise level accreditation where you're bringing all your hospitals together and then ensuring that they follow a similar processes and guidelines, and you're doing a benchmarking about the performance of every hospital, right? So what we did is, I think when you start anything, first thing is required to leadership alignment. So of course when we decided to go for it, so we ensure that leadership is with us, otherwise you can't take that kind of decision, bigger decision. Then second one is that how do you standardize the process, right? So we came up with a concept called 1NH, 1 process. So if we are doing one process, a clinical or a non-clinical in Health City, then the same similar thing or the similar way it has to be followed in maybe our hospitals in East or hospital in South or hospital in North, right? So we started developing that standardization within the group. Okay, we started discussing with all the stakeholders, and then at the end of maybe a hard work of 1.5 years, we could come to a process which is called NH processes, right? So which was standardized. So we came up with a thing called 1NH, 1 process. And after that, now once you have the process in place, then how do you go ahead and make sure that it is implemented and integrated, right? So we started with a very structured kind of a program which included how do we train the stakeholders, how do we integrate those processes in their workflows, same thing is, and how do we measure the compliances. So this entire thing we came up with a strong governance framework. Through that we could implement that, plus that stakeholders buying in and something which you have to really earn it. So that we used all our change management skills to ensure that we have buy-in from the stakeholders and we could implement those processes in place. And just to mention a little bit more of our hard work, so I think in the duration of 1.5 years, we would have spent more than 6 months traveling or sitting in the flight, okay, staying in the hotels, working day and night. And it's very important for me when you see that your team is working so hard to make sure that that everybody maintains their sanity. So we started ensuring that everybody is physically fit, we are mentally relaxed, okay. So we tried everything whenever we are staying out, that we are running, we are doing swimming, and we are interacting with each other. We have good conversations when we come back after the work. So this is something which we had to consciously do it, or maybe I have to consciously do it amongst the team to ensure that they are motivated and we are getting the results what we aim for.
Yeah, I think it's a very important point made by you. So while the work happens through multiple protocols and multiple systems, it is, and if it takes 1.5, 2 years, 3 years, then it's extremely important that you have the same team and the team stays motivated. So I think you've rightly pointed out this is rightly pointed out in the right direction for anyone who's looking for a bigger project or who's heading the big project for another 2-3 years. Yeah. Thank you so much for that. Ma'am, you're also a certified professional in healthcare quality from USA and a Baldrige assessor, right? So how do international standards in quality management when we compare it with India's evolving healthcare quality landscape?
Okay, so I'll just go back to the international, how do they work there? So there they have a very very well defined regulatory framework, or it is driven by insurance or by a lot of other agencies, that you will have to ensure that you have a compliances with all the quality and safety standard, right? But when we come to India, or we come to nationally here, we don't have we have some framework, but it is not very stringent. It doesn't drive you to ensure that you follow that quality and safety standard what we have in the West, right? And I'm sure it's coming here. It's not that it is not coming here in India, and we are getting mature in that. But as of now, we don't have that kind of rigid framework or a standard. We have a lot of laws and regulation which is applied to the hospital, and we do follow in Narayana all the laws and regulation, because that's a prerequisite for getting any accreditation. But if you say that everybody is following the way it should be supposed to be followed, it's not that rigid right now, right? So it makes us very hard to ensure that we all following the standards, or quality and safety standard what is supposed to be followed in the hospital, or sustain with it. So what we have to do is we'll have to put some internal mechanism or internal framework which ensures that your quality and safety standard is in place. So that makes it a little harder in India, because you don't have any enforcement or any monitoring agency which comes and tells you, and all accreditation are voluntary. It's not that it's you have to get those accreditations. So it's every hospital, because they want to follow quality and safety standard, so we go for accreditation. We invite them as a voluntary, that okay, you come and audit our systems and then let us know where we can improve.
Oh, I wasn't aware of that. I thought that there are certain standards that have to be met as per the government.
Yeah, there are laws and regulations which is applicable for healthcare, which you're supposed to meet it to ensure continuity of your operations. But when it comes to accreditation and certification, it's totally voluntary. That you apply for it, and then you invite your external surveyor to come and look at your survey, and then give you the certification for quality and safety.
So while we have spoken a lot about how to ensure quality across the healthcare sector, but there is also a very critical issue, patient safety, which is a problem across the globe, right? So WHO estimates, and I'm just quoting that, around 134 million adverse events occurs annually due to unsafe hospital practices in middle and low income countries, right? So what are the common yet overlooked risks in hospital settings, and how they can be mitigated?
Okay. So, I'll just give you an example which is already been published, okay? So, I'm not quoting any data which is from India, but yeah, which is published, as you mentioned, WHO itself, okay? So, last year the theme was across the globe, the theme what they projected as on World Patient Safety Day was, improving diagnosis, okay, for patient safety. Yeah. So with the slogan, what they came is make it right, make it safe. So with that, you can understand there are errors happening in the in healthcare or in any hospital, which is as critical as it is related to the diagnosis itself, right? So then all of us, even in our own organization, we started looking at how actually we are doing diagnosis and how can we improve it, right? Mm-hmm. So technology is one piece which is also coming in a big way, which is help us in improving the diagnosis for the patient safety. Then talk about the other statistics which has been released in 2022 by Joint Commission itself, Joint Commission International, which is JCI, that out of the Sentinel event, what has been reported, I'm not talking about the incident, I'm talking about the Sentinel event which has been reported. Out of that is 48% is the patient fall. So this is something, all of us are trying hard to put that thing in place for the patient fall. But still, if you say the 40% harm is done because of the patient fall, and approximately 8 to 10% is because of the wrong surgery. Yeah. So you can when you look at the statistics, you know that how vulnerable we are, and there are errors happening in the in a healthcare organization, and that's where the quality comes. That where you set processes in place, you put controls in place to ensure that we are not doing that. So whether in terms of putting a fall prevention protocol, or using technology for improving diagnosis, or putting some kind of what we call in our quality language is International Patient Safety Goal, which is IPSG, to make sure that we are not getting into a wrong surgery or a wrong procedure, or we are not doing something with the wrong patient what is not intended to do. So, I mean, we are putting a lot of processes in place, but still this is a statistics which is released from the internationally. It's not even only the Indian statistics.
So from patient safety, now I'll move to the other side of the table. So how do you think, with the growing advancement of AI and digital transformation in healthcare, how do you see this playing a role in enhancing the hospital quality and patient safety?
Okay. So, I'll just tell you, if I look at my last 10 years of my quality journey, so quality was considered as a paper department. The major paper what is used is in the quality department, right? So with the digital transformation what we had, it just makes sure that we have moved away from paper and then coming to a digital platform, which not only reduces our paper consumption, but of course brings us a lot of process compliances, plus your data validation, because your everything is getting validated. You know the source from where it's coming. You have a better visibility of everything. You can analyze in a better way, right? So that all started happening with the digital transformation. Okay. Now we'll move to another level of thing which is called artificial intelligence, okay, which is AI. And I'll just talk about only few use cases what we are using currently AI in ensuring the patient safety, right? So one is definitely is a predictive scoring, which all of us are trying to use it in a very, very effective way. That predictive scoring which tells you the patient, when the patient is at risk, right? For maybe infection, or maybe for a sepsis, or the patient is getting deterioration in ICU, right? So something which we can predict and then ensure that we provide the treatment, or we provide the required care well within the time, or maybe before the time when we are able to predict it. And something which we are piloting now is our early warning score. So that we are integrating across all the beds, okay? So where we have the clinical alarms, or which is all your early warning scores are triggering us that, okay, the patient is going to be getting deteriorated in another 4 hours or 6 hours. So we can take and we can put our plan beforehand, right? So these are few things which, we are using AI in terms of enhancing the patient safety. Now see, any technology is good only when it is helping your stakeholders, right? Be it the doctors or be it nurses, right? So with initiative which is called Medha X, right? So which is going to make our doctors' life very easy when they're doing a documentation, is going to give them more time when they're interacting with the patient. So the interaction is meaningful, and at the same time you're getting your work done, you're getting your documentation done. So I think the technology is something which is, of course, enhancing your patient safety, plus giving a lot of, support when your stakeholders are doing their work in terms of time or in terms of prediction.
Globally, there has been a strong push for value-based healthcare, where hospitals are rewarded for patient outcomes rather than the volume, right? So do you see this shift happening in India? And what role does quality management play here?
Okay. So you're right, the shift is happening even in India, okay. Earlier you see, there's a lot of question asked from your patient which is in the West. They want to be, engaged, and they want to understand totally the process. Same thing is happening in here in India also. The customers are more aware. They want to understand everything, what's going to happen during a procedure or when they are in the hospital. They need more transparency. They are data driven. They have the statistics and the data with them, okay, and they want to be engaged. The family wants to be engaged throughout their care process. It's not that, if you're not informing them something, they are fine with it. You'll have to inform, you'll have to take their feedback, and they want to be part of every decision you take for that patient or the family members who's our patient, right? So in that, when you talk about quality, how do we play a role is, we make sure that you have a process where there is an outline provided to every department or every staff where the kind of information you are supposed to give it to the patient, right? So when the patient is coming on admission, that what kind of information is provided to the patient. When the patient is posted for a procedure, before that, what all information you have to provide. I mean, in every step till the discharge, that what kind of information is required. And if I just talk about accreditation, there is a dedicated chapter on this, which is called patient-centered care, right? Where we outline all the entire patient journey and we make it mandatory that these information or education you have to provide to the patient, right? Then the second one is your informed consenting procedure, right? So what kind of information we provide to the patient before the patient opt or make a decision for a procedure, right? If like, let's say if you're going for a procedure, definitely you want to understand what is the risk, what is the complication I'm going to have it, what kind of benefits I'll get it when you are completed with this procedure or when the procedure is done. Then what are the alternates available for this procedure, right? So we have make sure that everything is involved or everything is included in your consenting procedure. And that is done on a time where the patient has enough time to take decision or he has enough time for not opting for that particular procedures. So those things we have set in place completely. The third one is what happens after procedure. How do you know whether the patient has got the benefit for which he has undergone that procedure, right? So for that, rather than collecting only the patient experience, which includes your service standard, your waiting time, your TAT, and your behavioral aspect, so we started collecting the outcome measures from the patients, which is called as patient-reported outcome measure. Okay. So for every procedure, if you're expecting a particular quality of life and you're reducing the pain, or if you are improving their daily activity of living, so everything is comprehended in that particular questionnaire, and that we send it to our patients, okay, be just after the procedure or maybe after 6 months and 1 year, and we see whether the patient is getting the benefit what it was supposed to give after the procedure is completed. So this data is actually a very, very important for any organization or for especially any healthcare organization to understand your clinical processes, your actual outcome. See, all of us do a lot of monitoring of the outcome measures in the hospital, be it the mortality or average length of stay or a complication. But what is important for us to understand what patient is getting out of that, right? So you collect your data, you measure your own performance, you benchmark against an industry. But actually what is required is that what your customer gets it, right? So something which we have initiated it in NH, that is called patient reported outcome measure, and I'm sure that's going to give us a very good insight about what's happening in our clinical domain.
Yeah, definitely. So I would like to just quote one example from my personal life. So my mother was very frightened when she was undergoing knee replacements, and she used to ask a lot of questions, and there was no reference at that point. So she suggested the doctor herself that, okay, why don't you have references in future for your future patient, because that will kind of build a lot of credibility to this. So similar to what you have outlined towards the end, that there should be some kind of score where we get to know exactly how the patient is feeling and how he or she is doing post the whatever the care that we have provided. And luckily, post her both the knee replacement, she's having an amazing life. In fact, she has become a proponent of that, and her doctor is quite happy because on her suggestions, at least he has got two, three more patients he's got out of it.
Just coming from your conversation that your mother was really looking for some kind of references where she can trust and then see what happens in that procedure. So we are also in the process of building a lot of support community or we have few for oncology and all, where the patient interacts and they understand what happens in the procedure and they understand the journey for that particular procedure or a treatment. So I think this is something which we are also trying to focus on that, and then build a lot of support community for patients to understand and then getting to, yeah.
So, ma'am, now I want you to reflect upon your personal journey. It's been an illustrious career for over 20 years now. So, what is your biggest lesson that you have learned about maintaining excellence in hospital operations and quality?
Okay. So, in last 20 years, what I've learned, I just want to summarize in few words or maybe few sentences. That that in quality, right? In quality, what we always say, it's a continuous process, right? It's not that you implemented one time and you're going to stop at that. So, and even why I say continuous process is that we'll have to keep adapting our new guidelines which is coming, new evidence based treatments or guidelines or whatever is coming up, right? So in other words, I can say that in quality, if we stop innovating, or if we start progressing, or if we don't push our boundaries to implement what we want to implement, then we will not be able to maintaining a high quality and safety standard in the organization. So this is something which is called as a continuous evolution, which is we have to do it in QMS, any QMS, whether it's in healthcare or any other industry. Then only we can meet our the best standard in the industry which is available. Second is just a mindset, okay? Or we call it it's a relay race, right? Or maybe an orchestra, right? Where everybody is important, and if they are not in sync, then you cannot deliver what you want to deliver, right? So making sure that every stakeholder, everybody in the organization, be right from the housekeeping till the leadership, or maybe a front line to all the nurses, doctors, everybody is aligned, everybody understands, and they work in sync, right? So if you're, for an example, like if your housekeeping is not doing the work, or maybe not doing the cleaning what is supposed to do, right? You have an impact where you have an impact on a patient safety, right? Infection control processes, you're not maintaining hygiene. So everybody who works in healthcare, be it a support or a clinical team, everybody is important. And if we work together, then only we can achieve the standard what we want to achieve. The third part, what I was saying, is embracing the technology and the analytics, which is very, very crucial part to get your right kind of QMS implementation or a quality management system implementation. So I'm sure, like, after we have got Atma, the kind of data or kind of insights we are getting about a clinical process is much different or much better in terms of getting an opportunity for the improvement. And also you can say the life before Atma and the life after Atma is very different. It's better, it's much better right now.
We've spoken at length about almost all the topics under the roof now, but one thing I wanted to know from you, what is your vision of healthcare quality in India, and how do you see NH leading this way?
Okay, so first let me talk about the larger perspective. What's happening in healthcare right now is one piece is your regulatory framework, the government policies, and the way the government healthcare networks is coming up, right? Recent example is Ayushman Bharat. Okay, so the regulatory framework is going to be more stringent for healthcare. Okay, doctors are already part of your consumer forum. Okay, so that is already building a lot of pressure for quality and safety standard in the hospital. Okay, and second one is your customer, which is your main piece, and they are becoming more and more aware. So if I talk about the technology part, now that AI is making them more and more knowledgeable about everything, and there are platforms where your ratings are available, be it a Google rating or any other rating. So it's not far, like we select other product, everybody is going to select healthcare or a doctor based on those ratings, right? And ratings are becoming very, very important, right? So where this quality and safety standards become very non-negotiable, right? And currently we don't publish any data anywhere outside, right? Be it in our there is no forum where we have to demonstrate our performance in terms of the clinical outcomes, right? But that day is not very far where we are going to demonstrate our clinical platform. We have to publish mandatorily. We have to publish our data outside, right? So in that case, the quality and the safety standard what we follow in our organization is going to be very, very crucial. to even to run our business, not only about providing a good quality care, even to run our business efficiently, we will be needing those kind of data driven approach, that where we are reviewing our own data, we are monitoring our performances, and publishing it outside. So this is something which is going to come. In NH, in my whatever I remember, that NH leadership never do anything, or never we have gone for any accreditation or a quality standard because just we want to complete that that task. It was always in an intent of that we want to improve, right? Since it's a voluntary process, but our intent was always to improve and continuously improve. So this is something which we are already aligned with, and right. And the second part is the technology, where we understand the kind of landscape we are going to get in future. So our technology is already embracing everything. We have a patient engagement app. We have a lot of technology or maybe analytics driven platforms, right, which is giving us the data to understand our own shortcomings or own improvement opportunities. I will not say shortcomings, I will say the improvement opportunities, what we can do it right now, and then be ready for the future. Additionally, we have also simplified a lot of processes, and by developing the app, which is much more convenient for our healthcare providers to use, as maybe one is for the app is for the doctors, or now we are coming over for the nurses and the administrators, which ensures that all of the healthcare providers are available 24/7 to get the best care possible.
With this, we conclude this episode of Healthcare Off the Clock as well. Thank you, ma'am. Thank you so much for sparing your time and enlightening our audience with the discussion around the quality across healthcare within India and within NH. I would like you to request our audience to like, share, and subscribe to our podcast, Healthcare Off the Clock.
Mukul, thank you for giving us this opportunity, and I think it's very important and for our audience to understand what quality means in healthcare, and I'm sure you would have got some good insights. How do we work in healthcare space in terms of implementing quality standard? Do like and subscribe our podcast.